Hi, and welcome. Thank you for joining me today. Welcome to the first of our four-part York Circle at Home lecture series for the 2020-2021 academic year. My name is Julie Lafford. I'm the Executive Director for Alumni Engagement at York University. This webinar is part of our York Circle lecture series, which showcases the latest and most exciting research from York's leading professors, hosted by Dr. Rebecca Pillay-Riddell, Associate Vice President of Research here at York and Academic Chair of the York Circle. Although we aren't all in the same location, we recognize many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of the university. York acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaranto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Before we begin, I'd like to share a few updates from the university. Many of you have probably already heard the exciting news that York is moving forward with our long-awaited Markham Center campus. The campus will accommodate up to 4,200 students in Phase 1, with the flexibility to respond to future growth demands. We will welcome our first students in the fall of 2023. For more information and to see renderings of the campus building, please visit markhamcentercampus.yorku.ca. On September 1st, the university announced the creation of the new Faculty of Environmental and Urban Change, EUC. EUC brings together the expertise housed in the Faculty of Environmental Studies and the Department of Geography. This new faculty is believed to be the first of its kind in the world to bring together a critical mass of physical geographers, ecologists, social scientists, humanities researchers, and artists, whose innovative, world-renowned research addresses natural, built, and social spaces from a global perspective. And of course, the 2020-2021 academic year began earlier this month, and it goes without saying this year is a unique one. As we continue to work and learn remotely, the university is facilitating valuable experiential teaching and learning experiences, innovative research discoveries, and opportunities for community members to engage with one another in a variety of ways. You can read the full address by President Linton at yfile.news.yorku.ca. Thank you again for joining us remotely today. I know that some of you may be new to online events, so at any time, if you need help with this experience or have questions about the content, feel free to click on the Q&A button at the bottom of your screen, and our team is ready to help you. While we're not able to gather in person, we remain committed to the York Circle and to delivering relevant, engaging lectures to you, our alumni and friends. With this year's four-part series, we wanted to ensure each of you were excited to add these sessions to your calendars and join us throughout the year for what's sure to be lively and topical discussions on subjects related to the COVID-19 pandemic. I want to acknowledge the York Circle members who signed up for 3 or more sessions. As a special thank you from the Alumni Engagement team, you'll receive a York U mug after attending those sessions. And at the end of each session, you'll have the chance to win one of 4 $25 gift cards, courtesy of our affinity partner, NBNA. Stay tuned, we'll draw for the winners at the end of today's session. So today, Professor Pillay-Riddell will host a 45-minute presentation, followed by a 45-minute panel discussion with questions from you, the audience. If you'd like to submit a question, you can use the Q&A button at the bottom of your screen, and our moderator will pose as many of your questions to the panelists as time permits. Before we begin today's presentation, titled At Home and in School, Supporting Children, Youth, and the Adults Who Care for Them, I'd like to take a quick poll. My question is, how would you rate your knowledge regarding the topic of today's presentation right now? So that the question should be on your screen right now, and I'll give you all a moment to respond. Thanks for participating in the poll. I'll share the results in a moment. It's helpful for our speakers to know who's in the audience, and it's great also to see so many participants. I see there's over 100 of you here with us today who are engaged in this topic. And the results are that about 71% of you feel somewhat informed of this topic, 21 minimal, and one humble audience member has said not very much. He or she is new to the topic, and just 7% say very high. So it should be a great discussion today, and I look forward to seeing how much you learn before the end of the event. So at this point, I'm delighted to introduce our host to this series and today's presentation, Dr. Rebecca Pillay-Riddell. She's the academic chair of the York Circle Lecture Series. She's also a professor in the Faculty of Health. In 2018, the Faculty of Graduate Studies honored Dr. Pillay-Riddell with a Faculty's Teaching Award for achievements in graduate teaching and supervisory excellence. Additionally, Dr. Pillay-Riddell is a pediatric pain researcher and clinical psychologist at the Hospital for Sick Children in Toronto. An acclaimed researcher, she leads the OUT Lab, which stands for Opportunities to Understand Childhood Hurt, where she seeks to reduce pain in child health. You may have also seen Dr. Pillay-Riddell's work in the media recently. She has published a paper finding that skin contact with a parent may reduce babies' brain response to pain. So welcome, Dr. Pillay-Riddell. It's a pleasure, as always, to have you. And I'll turn it over to you to introduce the lecture series and today's presenters.
Thank you, Julie. Good morning and welcome, everyone. I hope today everyone is staying safe and well during this very crazy time. My name, as was introduced, is Dr. Rebecca Pillay-Riddell, and I'm the academic chair of the York Circle series. I'm honored to introduce our four-part York Circle at Home lecture series, which will bring together leading York researchers from policymakers to molecular scientists to dissect and discuss key issues related to the COVID-19 pandemic. An unprecedented time calls for an unprecedented format. We're so pleased to be able to respond to this challenging time by bringing together multidisciplinary panelists from over four sessions throughout the 2020-2021 academic year, all within the context of the global pandemic. This morning, we have the first presentation of our series titled At Home and in School, Supporting Children, Youth, and the Adults Who Care for Them During a Pandemic. We hope you would join us for the upcoming sessions on the following topics. In November, we'll be talking about the COVID-19 vaccine, production, policy, politics. In February, we'll be talking about the topic of racism in the pandemic, going beyond the health crisis. And we'll be concluding this series in April with the impact of the pandemic on the environment. I'm so proud to have helped to bring together this new series and looking forward to inviting these highly recognized and respected professors and scholars on screen to share their research with all of you in a few moments. As Julie mentioned, we cannot meet in person due to this pandemic, but we're honored to be able to provide a virtual opportunity for us to learn from some of the incredible faculty and researchers at York. Today's presentation will examine how politicians, parents, health professionals, and educators are struggling to determine what is best for students heading back to school this fall, whether that's virtually or in person. In this important and very timely panel discussion that affects so many of us during this time, York University experts will discuss the economic, social, and practical impacts of the pandemic on children, parents, and educators in relation to inequities in the current education system. Our first presenter will be Dr. Vidya Shah, assistant professor in the Faculty of Education, who will offer ideas on providing learning engagement focused on relationality, as well as community and critical consciousness. Following Dr. Shah's presentation, Dr. Stephen Gaetz, professor in the Faculty of Education, will follow. Dr. Gaetz will speak to the problem of supporting youth experiencing homelessness or who are precariously housed during the pandemic. Our final presentation will be Dr. Gillian Parekh, assistant professor in the Faculty of Education. She will explore tensions around education and care for students with disabilities. I'm so pleased that Vidya, Stephen, and Gillian could join us today. I know you will learn so much from their presentations. I will now turn it over to our first speaker, Dr. Shah. And I'll ask Dr. Shah. So Dr. Shah is an assistant professor in the Faculty of Education and teaches in the Master of Leadership and Community Engagement and Initial Teacher Education programs at York University. She received her doctorate in Educational Administration from the Ontario Institute of Studies in Education at the University of Toronto and her research explores the contributing factors to district reform for equity. Dr. Shah has worked in the Model Schools for Inner Cities program in the Toronto District School Board and was a primary, junior, and intermediate teacher in the TDSB. Welcome, Dr. Shah. Thank you for joining us today. I'll now turn it over to you for your presentation on ideas for providing learning engagements focused on relationality as well as community and critical consciousness.
Thank you so much. I'm so happy to be here, and thank you to the York Circle for the invitation to speak today on such a timely and important manner. I'll begin with some thoughts that I have. There has been significant speculation and imagination about what a return to schooling would look like in the midst of a global pandemic. There have been queries about physical distancing, personal protective equipment for educators, safety protocols for children, the physical cleaning of classrooms and school buildings, changes to class schedules, a massive shift to online learning for many students, educators, and families, the need to attend to the social and emotional well-being of students and staff, and more. And these queries build on the different experiences that students and families have faced during the pandemic. My query has been, how do we relate to the crisis of COVID-19? And who do we become in the process as educators, as those connected to education, and as humans? Are we guided by self-interest, greed, and opportunism? Or do we relate to the crisis as an opportunity to imagine ourselves and our world anew? How might this time of global upheaval, massive uncertainty, and the significant changes to our daily experiences influence the how and the why of schooling in publicly funded education systems, and how we challenge or perpetuate historical barriers to educational access and opportunity? You know, a few months ago, after the initial shock that we were living through a global pandemic, I began to wonder what might happen if we were to pause and reimagine possibilities for schooling in both K-12 contexts and post-secondary. Back in March of this year, the idealist in me wrote these words: what might be possible if we redirect our efforts away from recreating broken systems and instead allow ourselves to grieve how these broken systems have kept us separate and fragmented, creating hierarchies of domination and the very need for domination itself? What if this rupture in time and space, this global pause, this automatic reset, is an invitation into different ways of being, thinking, and living with ourselves, with one another, and with our environment? This moment invites us to recognize and value our inherent interconnectedness, spiritual wisdom that has long existed in global Indigenous communities. It is an invitation to blur the lines between self and other, between us and them, between winners and losers. While cracks in our systems have always been our greatest vulnerability as a collective, some of us have chosen not to see them. We have intentionally turned away from these injustices. This moment is inviting us to see that our suffering and our healing is deeply interconnected, and that our society is only as strong as those who have been abandoned and neglected all along. And in particular, I was reflecting on particular communities. In addition to the state-sanctioned violence against Indigenous people and the ongoing theft of land, many Indigenous communities living on reserve during COVID-19 are doing so under boil water advisories and inadequate access to health systems. I'm thinking about families currently experiencing housing and food insecurity or living in poverty, and those that are worried about job loss or housing loss going forward. I'm thinking about families with members that are immunocompromised. I'm thinking about families living in shelters or families with loved ones who are incarcerated that are at higher risk of contracting COVID-19, being in confined spaces with less opportunity to self-isolate. I'm thinking about families that are non-status without access to universal health care, families with undocumented migrant workers that are risking their lives and their health to provide some of us with food during these times while facing grave labor injustices. I'm thinking about families that have experienced increases in child, sexual, and domestic abuse. I'm thinking about families that have experienced deaths both to COVID-19 and other related disease. I'm thinking about families experiencing challenges with mental health. I'm thinking about families that have children or members with disabilities and cannot access the necessary supports, and more. As spring came to a close, the realist in me emerged. In times of greater crisis and strain on systems and structures, longstanding inequities are simply exacerbated. In education, Societal inequities are replicated in schools along the lines of indigeneity, race, gender and sexuality, class, disability, status in Canada, faith, and more. In this time of a global pandemic, we are seeing growing gaps between the ability of private and public schools to support the safety and well-being of children. We have seen massive inequities with regards to student access to technology and Wi-Fi. We have seen the disproportionate impact of COVID-19 on racialized families and communities. For example, some earlier stats came out that said that Black people and other people of color make up 83% of the reported COVID cases in Toronto. And within that, Black, Arab, Middle Eastern, Latinx, South Asian, and Southeast Asian people are grossly overrepresented in COVID cases given their population in the city, while white people are severely underrepresented. We also see higher proportions of COVID cases in lower income households, and we know that Black, Indigenous, and some racialized groups are more likely to be food and housing insecure, have precarious or limited employment, or are living in poverty. Are frontline workers and essential workers and face greater discrimination in all institutions. So COVID, like schooling and like society, is not color evasive. Many of the families and communities living in the city of Toronto have been living through another pandemic that we have yet to name as a society. White supremacy and settler colonialism have existed in Canada long before March 2020. The question is, why haven't we seen these oppressive structures as a global crisis? It makes me question whose lives matters, who is deemed worthy and who is deemed disposable, whose pain and suffering is avidly attended to and whose pain and suffering is erased. A carefully crafted concoction of denial and silence and ignorance have contained the second pandemic to the untold and often ignored realities of many Torontonians and Ontarians, and have intentionally averted any significant systemic and structural changes to address longstanding inequities in all of our institutions: justice, policing, child welfare, healthcare, housing, immigration, and of course, education. Since colonization, education has been weaponized as a tool to inflict and commit cultural genocide against Indigenous peoples. We have a responsibility to repair damages done in the name of education and civilization, to understand that schools are often conflicted and unsafe spaces for Indigenous students and families. We have failed in our attempts to meet the 94 calls to actions outlined in the Truth and Reconciliation Commission, and in particular to the contexts of schooling in K-12 and post-secondary contexts, calls 62 to 65 in particular, that focus on curricular changes, funding allocation, training, and a national research program. In Ontario, schooling anti-Black racism manifests in the disproportionate punishment, suspension, and expulsion of Black students, the streaming of Black students into locally developed and applied classes, and into particular special education classes in kindergarten to grade 8, and the simultaneous streaming students out of Black students out of gifted classes, French immersion programs, specialty art programs, and more. We think about the dehumanization of Black families and communities as they interact with schools and school officials, the curricular violence that exists in the erasure of the histories, realities, and aspirations of Black diasporic people in Canada, and more. So what challenges, and more importantly, whose challenges are important enough to be deemed crises? Who determines what supports will be put in place and when? And what is the criteria used to determine when a pandemic is over? Perhaps the better query is, for whom will COVID-19 be an opportunity for transformation, and for whom will it be another case of opportunism? In her book, The Shock Doctrine, The Rise of Disaster Capitalism, Naomi Klein traces how the aftermath of Hurricane Katrina was used in New Orleans to convert the majority of traditional public schools to charter schools within 19 months. Charter schools, like other aims to privatize public schools, have disproportionately negative impacts on historically marginalized populations, Black, Indigenous, and racialized families, and families living in poverty. While there is growing interest to create charter schools in parts of Canada, we are seeing efforts to privatize education in Ontario operate in particular ways. There were calls for e-learning from the provincial government that started long before COVID-19, and that would likely reduce the number of classroom teachers and outsource large amounts of public education dollars to private technology companies. As we move into an era of unprecedented online learning, we have to be vigilant about efforts to normalize online schooling that was developed in response to a pandemic. And so while educators and faculty are doing their best to recreate a sense of community and rich learning experiences online, mass efforts to increase online learning in a post-pandemic era will de-emphasize the importance of relationships, creativity, co-constructing knowledges, and developing critical consciousness that are such crucial aspects to the learning experience and increases inequities to access. Our colleague Sue Winton in the Faculty of Education recently wrote a piece in The Conversation about a rise in learning pods or pandemic pods. Pandemic pods are small groups of children from different families who learn together outside of the traditional school building, similar to homeschooling or private schooling. This is yet another example of the rise in privatization in education. A third example is that efforts to reduce the presence and collective power of labor unions is another move to increase privatization in education, as well as this is all against the backdrop of an analysis by the Canadian Centre for Policy Alternatives that stated that Canada's top billionaires added $37 billion to their fortune since the pandemic started during 6 of the most economically catastrophic months in the country's history. We also think about who has a choice to be able to work from home and who must physically go to work. Disaster and crisis have the potential to breed opportunism, which has historical roots in colonialism, white supremacy, and capitalism, and contemporary manifestations of grave injustice. We are seeing growing gaps between intergenerational wealth and intergenerational poverty, and we will also see growing gaps in opportunity and achievement in education. But crisis also has the potential to return us to more just, humane, and compassionate approaches to schooling and society. We must see how the cracks in a capitalist system have created haves and have-nots, and we might even allow these cracks to break us open to new ways of being in relation and in community. We have seen the Canada Emergency Response Benefit build momentum for a guaranteed basic income and calls for a greater allocation of resources to our social safety net. We are seeing unprecedented moves to support housing for all. We are seeing calls for a national childcare program. We are seeing calls for abolition as Canadian justice and correctional systems have taken several steps to reduce the number of people in custody, including early release of low-risk offenders. We are seeing efforts to rebuild an economy that addresses climate change. We are seeing the possibility of students receiving the technology they require to engage in learning in the 21st century. So the final question that I'll pose is, how might we honor and continue histories of Indigenous, Black, and racialized resistance towards an education for freedom? In this time of global pause and racial reckoning, how might we seize this opportunity to resist traditional educational discourses, to legitimize marginalized knowledges, and to imagine future possibilities? Thank you so much.
Thank you, Dr. Shah, for giving voice to the voiceless. Your passionate talk was very powerful, and I appreciate your time.
Thank you so much.
Now I'd like to turn the floor over to our next speaker, Dr. Stephen Gaetz. Dr. Gaetz is a professor in the Faculty of Education at York. And is Dr. Gaetz going to pop up his screen? Is a professor in the Faculty of Education at York, president of the Canadian Observatory on Homelessness, and scientific director of Making the Shift, a youth homelessness social innovation lab. A leading scholar on homelessness, Dr. Gaetz focuses his efforts on working in collaboration with partners to conduct research that will guide and inform solutions in homelessness. He has been playing a leading international role in knowledge mobilization about homelessness through the Homelessness Hub. And in 2017, he was awarded the Member of the Order of Canada. I'll turn the floor over to you, Dr. Gaetz, to discuss the problem of youth experiencing homelessness or who are precariously housed during the pandemic. Take it away.
Thank you. Thank you for the introduction. And thank you everyone for giving up your Saturday morning to attend. I've been really looking forward to this. And I want to share some of the things that we've learned around youth homelessness in this context of the pandemic. So I'm going to share a screen now. And there we go. Okay. So in the context of COVID-19, it's important to understand, as Dr. Shah said, that different people are affected and impacted differently by this kind of thing. And so let's see how it impacts on people who experience homelessness. Now, to start, I want to just give you a little bit of background around youth homelessness in Canada. So on any given night in Canada, we estimate there are maybe 6,000 to 7,000 young people experiencing homelessness who touch the system. So this doesn't include the many young people who are doing what we call couch surfing, staying with friends or relatives because they can't remain at home. And homelessness as a problem, we often focus on the foibles of the individual, but really it's a structural problem that we have created and we allow to sustain itself. When a young person becomes homeless, what we should do is try to resolve that as fast as possible and make sure they don't become homeless, but we don't really do that. We have an emergency response system that often leaves young people mired in homelessness for years. And that's bad news because we know when we let young people become homeless, their health worsens, they're more likely to experience illness and injury, including brain injury. They're more likely to experience malnourishment. Mental health declines, they're subject to depression and often trauma. Exploitation, 20% of young people who experience homelessness have been trafficked, mostly for sex trafficking. And by warehousing young people, we essentially point the traffickers to where they are. It's like putting a big neon arrow on the top of the building and says, come and get them. Greater risk of addictions for all of the above reasons, more involvement with the law, even though they're more vulnerable to criminal victimization, their experience with policing is often at the other end, where they're seen as the problem. High rates of dropping out of school. More than 50% of young people who are homeless have dropped out of school, not necessarily because they don't like school or aren't doing well, but because the experience of homelessness really makes it challenging to participate. The trauma I mentioned, and all of these lead to entrenchment in life on the streets. So we have the vulnerabilities there. The other thing to note is that when young people wind up becoming homeless, after they've exhausted all the opportunities locally to couch surf, that kind of thing, they wind up often having to leave their communities, right? So not only are they losing their parents and family, they're losing friends, meaningful adults in their lives, teachers, these kind of connections. They lose their community and now are largely dependent on other young people who are homeless and professional service providers. So that's not a great outcome. So what about pandemics and homelessness? We'll go through some of the things. We've known this well before COVID-19, but just to highlight it, you know, that the experience of homelessness creates additional vulnerabilities. And these vulnerabilities, again, aren't because people who are homeless are doing something wrong. It's how we structure our response to homelessness. So as I mentioned, young people who are homeless are much more vulnerable to disease, illness and injury, and have compromised health due to a number of reasons. For young people, they're much sicker than they should be. Our institutional response places people in harm's way. We basically warehouse people, as well-meaning as our emergency response is. Most emergency shelters involve congregate living. And though during the pandemic, the city has done a good job of creating more spaces and social distancing, it's still, even if you have like 6 feet between cots, people are walking around and it's very difficult. Different subpopulations are going to be particularly vulnerable, and we know that. So like people who are doubly and triply marginalized because they're Black and homeless and vulnerable. And here's a key thing. The underlying assumptions of our response to homelessness, our public health response, assumes people have a home. So we all get told, wash your hands regularly, social distance, avoid being around multiple people, don't go outside much when it's locked down. All of these things are virtually impossible to do, or very difficult anyway, if you're homeless. And then finally, there's the ethical thing that we have to consider, and that is, if the pandemic got really bad and people who are homeless, if it swept through the shelter system, would we force people to go to shelters? We also use law enforcement, it's important to note, to deal with homelessness. And is that happening during the pandemic? So what do we know about what's happening? So at the observatory and with Making the Shift, We've done 2 consultations with service providers from across the country to gauge their understanding. We've also done a survey with youth from across the country. We haven't analyzed that data yet, but we do have information from service providers. And here's what we're finding out, that in addition to these things we've talked about around the pandemic, there are these additional challenges that young people are facing. Of course, they can't wash their hands frequently. The social and physical distancing is really challenging, but other things. A lot of their supports are shut down, like the drop-ins and day programs are not open. Many young people don't have adequate income. They're living in extreme poverty, and accessing government benefits, accessing the CERB is a challenge, right? Because there's a requirement that you're registered with CRA and that you've worked in the last 12 months in the formal economy. Now, many young people who are homeless work, but it's often under the table work or doing different kinds of things where there's not like they're not registered with CRA, as I mentioned. Doing harm reduction work is really challenging. Many young people wind up congregating in public spaces during the full-on lockdown because they don't have private space, right? So like going to parks is something that you would do if you were homeless, but we had a period where we banned people from going to parks. So these are all problems. Many young people who are homeless or precariously housed or are vulnerable to homelessness, in non-pandemic times, we are able to provide some level of pandemic supports. But this has been really challenging during the pandemic. How do we get out to people? The service providers are noting more mental health and problems and distress. They're reporting higher substance use, and also the fact that with social isolation in place, many young people are overdosing, and there's no one around to provide any kind of support. So things are kind of rough here. Evictions, even though we have a moratorium on evictions, we're seeing evictions amongst young people, right? It's still happening. And part of the challenge is that many young people are in living arrangements that make them vulnerable, and they may not be on the lease. So a landlord can just say, get out, that kind of thing. Now there's some positive things. The use of technology has been introduced for doing some kind of case management and support work. And that's, in some cases, works out really well. The rate of attendance for meetings goes up because people don't have to travel or go across town. But the flip side of that is that a high percentage of young people don't have access to technology, right? They don't have cell phones or computers or a place to do that. And the other thing, even if they do, they're often in contexts where they can't have a private conversation because they don't have a door that they can close. So one of the responses has been improved outreach, but it's still challenging. And so we see that that this is an important issue that raises lots of questions about what we should do. Now, we're heading into a new phase of the pandemic in Canada. The rates of COVID-19 are increasing, as I think everybody knows. This is also true in the United States and in Europe. But we're also at a time of change where things could go a number of ways. What will happen when we start to enter a recovery from the pandemic? It could go well or it could go not so well. So we can do things that aren't helpful, like if we cut income supports too soon, and that will affect marginalized people generally, but including homeless people. When we end the moratorium on evictions, will we see a massive rise? Will we return to austerity and cutbacks? There are political parties in Canada who still stand for that kind of approach. The expansion of the financialization of the housing market may get more extreme. And what that means, this started during the last economic crisis in 2008. Investment funds go in and start buying up property as an asset, and they don't necessarily rent it out or use it. It's just purely an asset, and it removes housing from the market in a time where we lack affordable housing. And the thing I worry about is we'll have a return to business as usual in the homelessness sector. Okay, I'm mindful of the time, so I'm going to move forward on some of this. So we've seen this past week, the Government of Canada announced a billion-dollar investment in building new housing or purchasing housing for to create more affordable housing. They have a 10-year national housing strategy. It's backloaded in funding, which means that most of the funding's in the final years. They could take that and put it at the front end, and that would be a job-creating activity, but it would also help us address the crisis. But what I want to focus on is the prevention. What you need to know in Canada and the United States, like we're not global leaders on how to respond to homelessness. There are 3 things you can do to address homelessness. The first is prevent it, stop it from happening. Support people right at that moment where they're vulnerable to being homeless or when they're newly homeless. The second thing is you're going to need an emergency response, a crisis response, because no matter how good your prevention is, people will still slip through the cracks. So you're still going to need some level. And then the third thing you need is to move people out of homelessness, but in ways that focus more than just giving them housing, but the kind of supports they may need to ensure they don't return to homelessness. In Canada, the bulk of our investment has been and continues to be on that middle part. And we avoid prevention in North America. It's like we'll get to prevention once we house all the chronically homeless individuals in Canada, which, you know, who knows how long that will take. We ignore prevention for the most part. The government of Canada has started to shift its language around prevention, which is really promising. And there may be some opportunities going forward. But why focus on prevention? I'm going to give you something to consider. What if we responded to this pandemic in the way that we respond to homelessness, right? What if we did the same kind of thing, right? What we would be doing is relying on the hospitals, right? That's the emergency response. We would invest in building giant waiting rooms. We'd ensure that people get bologna sandwiches while they're waiting. We would wait for people to be sick before we help them. Now, does that make sense? Do we do that? Well, not really. We don't do that. Well, maybe in Florida or places like that, but generally we don't. What do we think is important in a pandemic? We focus on prevention while at the same time ensuring that our emergency response is robust. So we encourage people to wear masks, and they're mandatory in certain contexts like going into stores and that kind of thing. We focus on hygiene, keep your hands clean. You know, people have bottles of hand cleaner. I have one in my bag here. My hands are very clean, by the way. We encourage social distancing. When the rates really get high, we encourage isolation. We engage in the strategic closing of specific services, right, to reduce the spread. And eventually we're investing in the development of vaccine, right? All of these things are preventive, and they all make sense. Because if we don't do this, we see a situation like in the United States where the rates of infection increase, and because we've waited so long, many people wind up dying. It would not make sense to do this. But the question then becomes, you know, related to this. So with a pandemic, we have this comprehensive approach to dealing with you know, what to do. And in Canada, I think though there are outliers, there's a lot of consensus about this, about the need to focus on prevention. I've got my mask here, and you know, that everyone's, for the most part, buying in. What if we treated our response to homelessness as if it was a pandemic? What would it look like if we did things differently? Now, as I said, we're not doing that in Canada. We're not doing it in the United States, but we could, and other countries are showing real progress in this area. So with the Canadian Observatory on Homelessness and our Making the Shift project, which we do in partnership with Away Home Canada, we've really focused on transforming how we respond to homelessness. So shifting from that diagram before to something that looks more like this. We need more investment in prevention, and we need more investment in ensuring people get housed and have the supports they need. And then still retain that emergency response, but allow it to do what it's supposed to do. If someone's been homeless for 20 years living in shelters, that's hardly an emergency response. What that is an inadequate and dangerous housing strategy that discriminates against people who are poor and with potentially mental health issues. So the question becomes, what do we do about this, right? Now, the good news is that we've been doing a lot of work in this area. We have been working to define what homelessness prevention is, because people will go, yeah, I get it, we should prevent homelessness, but what does that look like? We've been conducting research, and we're also piloting demonstration projects on interventions to support youth homelessness prevention. This document here, the Roadmap for the Prevention of Youth Homelessness, we released in 2018. It's basically a guide for how to prevent youth homelessness, all the way from addressing structural issues like the lack of affordable housing to systems problems, young people transitioning from child protection at 18 without having any housing in place, that kind of thing, to early intervention. And we've created this kind of pathway, this roadmap that shows the different kinds of approaches to prevention, everything from evictions prevention, housing stabilization, and duty to assist, which is the future. And so there's lots there on what to do. And as I said, we are investing in doing research on the different approaches and developing resources, training and technical assistance, and community engagement strategies to help spread this knowledge so that we can end this craziness. One last thing I want to say about youth homelessness is that our current system only helps young people when they're 16 or older at best. Some communities it's 18 or older. We know from research that 40% of all currently homeless youth had their first experience before the age of 16, 40%. And that group is particularly vulnerable. The characteristics are that they're more likely to had adverse childhood experiences, experience bullying, etc. So we need to do things differently. And one of the areas, in the Faculty of Education, I think this is important, is we're missing the opportunity to engage young people where they spend most of their time, which is in schools, and where they have engagement with meaningful adults in schools. There are really interesting innovations that come from Australia that focus on school-based early intervention, where you have community organizations that work well with young people, working in partnership with the school, so that when a young person is starting to experience homelessness, they will know where to get help. Also, the teachers who may be aware that Johnny is sleeping at the neighbors and hasn't been doing well in school lately, but the teacher doesn't know what to do, they now could direct someone there. And if we put in place practices that support teachers and meaningful adults to help young people get the support they need, young people and their families, we could have a serious impact on homelessness. And I'm going to give you one last stat. Of all people who are homeless, 50% had their first experience before they were 25. And so if we did a good job on addressing youth homelessness, we'd be actually addressing homelessness writ large. So thank you very much. I'm now going to stop the screen sharing. Thank you.
Thank you, Dr. Gaetz, for that very informative talk about your longstanding work and world-recognized work on homelessness and the idea of preventative work during youth for adult homelessness. A reminder before our next speaker, after the final presentation, we'll be hosting a panel discussion and taking questions from the audience. If you'd like to submit a question, please use the Q&A button at the bottom of your screen. Our moderator will pose as many of your questions to the panelists as time permits, and that moderator would be me. So now I'd like to introduce our final speaker, Dr. Gillian Parekh. Gillian? Dr. Parekh is an assistant professor and Canada Research Chair in Inclusion, Disability and Education within the Faculty of Education at York. As a previous teacher in special education and research coordinator with the Toronto District School Board, Dr. Parekh has conducted extensive system and school-based research in Toronto in the areas of structural equity, special education, and academic streaming. Her work explores how schools construct and respond to disability, as well as how students are organized across programs and systems. Thank you for joining us. I'll turn it over to you for your presentation on the tensions around education and care for students with disabilities.
Thank you so much. I'm just going to turn on my screen sharing here. There we go. Excellent. Well, thank you everyone for joining us on this Saturday morning. It's beautiful outside, so really appreciate you tuning in. I'm going to begin telling you a little bit about my relationship to disability. So I arrived to disability studies from key experiences in my own life and family. So I'm going to get a little personal in this presentation. Hope that's okay. Well, apologies. Oh, there we go. Here's me at age 9, hanging on to my younger brother Thomas, and he did give me permission to share this picture for this presentation. In this picture, we just moved to a new house, one that could accommodate his wheelchair and one that my dad could retrofit with ramps and widened doorways. I love this picture because there's a fierceness in my brother's expression that exposes his true troublemaker nature and readiness to confront any barriers in his path. He's now 38 years old, which I guess ages me as well. And after having to navigate the education system, the medical system, and the care system, we've learned that it doesn't necessarily matter how resilient you are or how fierce you are. If systems are structured against you, you are the one that's going to lose. And this is why disability studies is so important, because its focus is on changing structures and confronting ableism. I remember hearing it dismissed once as an activist field, and I thought, yeah, it is, and we need more like it. So in disability studies, we think about disability differently. We think about our impairment as something that affects our physical, cognitive, or emotional functioning. For example, losing your sight, or your hearing, or your capacity to remember. But disability is something different. Disability or disablement comes from outside the person. It is something imposed. Disability is a consequence of ableist policies and practices, of assumptions around ability, and the devaluation of persons living with impairment and their contributions to society. Disability is encountering a set of stairs leading into the restaurant where your friends are having dinner. Disability is an inaccessible ballot box during an election. And disability is being denied access to technology or devices that enable your participation, like glasses, communication technology, or a mobility device. So in disability studies, we think a lot about the consequences of structural practices and policies. Many disability studies scholars focus on how institutions respond to disability and investigate a wide range of institutional spaces, such as hospitals, care facilities, schools, group homes, prisons, child care centers, and so forth. So for those of us in disability studies whose focus is in education, we question things like, what is the role of special education? Is it helping or is it harming students? We think a lot about pedagogy and who is included in the curriculum, who is given access to curriculum. We think a lot about care. How is care made accessible? How care reflects the aspirations and desires of the one being cared for. Like in Steve's work, we query how care systems could be more responsive to the needs of the communities they serve, and how institutional responses can exacerbate vulnerability. So for years, my work has queried the role of self-contained special education programs in schools. So self-contained means that all children in that program or school have an identified exceptionality or disability. And while I can think of many reasons why inclusion can be better, and not just because of the legacy of activism against the segregation on the basis of disability, and how research supports inclusion, I can appreciate how certain specialized self-contained programs in schools, as they are currently structured, can function as a way for families to access important integrated services. In some locales, schools have done an incredible job at facilitating access to speech and language services, physical and occupational therapy, social work and health services through the classroom. The same arguments can be made for the logics of group homes and long-term care facilities. When you have a congregated population who could all benefit from a particular set of services, why not bring them together and integrate the services in a way that promotes accessibility? When consumer logics take over, then yes, this makes a lot of sense. But what we fail to consider is that when we congregate people together based on a human quality, that it can be devalued within society, such as disability. Conditions can become dangerous and their vulnerability can be amplified. Services and facilities for people with disabilities are generally underfunded and understaffed. There is often little recourse to report complaints or abuses, and an increased risk for isolation and losing ties to the larger community. This may have never been more evident than when COVID-19 hit. In May of 2020, over 80% of COVID-related deaths in Canada were related to long-term care. Although this has been painted as an issue for elderly people, please note that every person in a long-term care facility is there because they are disabled, and many happen to be older. There are many young people in these facilities too, and I know this because my brother is one. In his early 20s, while he was pursuing graduate studies, Thomas's care became such that he required around-the-clock support. And after his experience with personal attendance failed, he opted to move into a long-term care facility. This move addressed his immediate physical care requirements, but made him far more vulnerable in other capacities. When COVID-19 hit, his facility and a sister facility went into immediate lockdown. His facility ended up with 0 cases, but his sister facility ended up with 345 cases and 53 deaths. As Vidya and Steve have described, as unnamed crises, the crisis in long-term care and access to services for disabled youth, adults, and their families is not new. Institutionalized or congregated care has always had a terrible track record when it comes to the management of contagions, and this pandemic has exposed the policy and structural failings of institutionalized care design. So, the March 2020 closure of schools has been really hard on many families. Families have lost access to communication technology and services. The move to online learning has been slow and very slow to respond to accessibility concerns. And for parents, the care provided by schools can be an essential part of enabling their own capacity to go to work. This past month, Statistics Canada released its survey results on the impact of the pandemic from the perspective of parents of children with disabilities. And the results indicated that parents of children with disabilities were more likely to be very or extremely concerned around the impacts of the pandemic on their children's physical and mental health, as well as the academic success in school. Knowing this, knowing everything, all that we've just discussed, I appreciate the dilemma the Ontario Ministry of Education and Ontario school boards face in attempting to implement full-day, full-time educational programming and congregated sites for students with disabilities in a way that is also safe. As mentioned, some school boards continue to offer specialized education programming in self-contained schools for students with disabilities. And in many ways, these schools offer similar services and activities to care facilities coupled with educational programming. As such, I was paying really close attention to the return rates of students and did find that one board had posted their initial registration results online. Now, having, as the number of COVID cases, as Steve was mentioning, have risen dramatically in the past few weeks, these proportions may no longer be accurate. I know there's been a lot of flux between in-person and online schooling. However, they did paint an interesting picture when they were first reported. So at this time, roughly 3/4 of all students in the system were planning on returning to school in person. But when we looked at populations that were attending special education schools, that was roughly about 50%, so a considerable drop. So as primarily a quantitative researcher, I know that working with numbers alone does not a case make, but it does allow us to think through some important pieces of the puzzle. For instance, such a dramatic drop could suggest a distrust in how safe congregated learning is for students with disabilities at this time, particularly when we have just seen what has ripped through long-term care facilities. For many parents of children with disabilities, not being able to access school could mean that parents are staying home, facing what could be a devastating loss of services. To me, this screams of needing more flexible and responsive care strategies, such as a care system that is nimble in its structure, so that in a time of contagion crisis, there are many options for support. The only option for families to access services should not be through congregated care, whether that be educational or care facilities. In fact, if systems were created to be nimble from the start, they could address the worsening systemic crisis in institutionalized care and play a role in its future prevention. As a disability studies scholar, what I hope comes out of this is greater activism and reform, reflecting the importance of diversifying support services, bolstering family-led and client-led care to ensure that families can access the supports and services they need without having to compromise their children's and their family's safety. We need an approach to education and care that not only values the lives of disabled people, but sees autonomy and agency in care as a form of justice. Thank you.
Thank you so much, Dr. Parekh, for your comments and your personal journey. It always adds such a large dimension when we're communicating about our research. So now what I'd like to do is I'd like to invite our members in our audience to submit any questions they may have for our speakers. If you're watching us on Zoom, please use the Q&A function at the bottom of your screen to pose your questions. We'll be welcoming some members of the audience to speak their submitted questions live to our panel members. So keep an eye on your Q&A button for prompt instructions from our team. For those of you who are watching us on Facebook, please submit your questions using the comment box for this video. So before I turn it over to the Q&A, I was asked to have some comments as the scientific or as the academic director for the York Circle, and I wanted to share a little bit about how we got here and my journey, I think, in responding, in trying to understand and put together all the information that has been presented to us today. So I think over the summer I was working with York Circle, with Ben, with Carrie, and we were trying to figure out what we wanted to do with York Circle this year. And we really came to the point of trying to understand that the pandemic, while sometimes we may want an escape, is actually something that's very front in mind of all of us. And so going and exploring different topics about the pandemic and being able to open up a community opportunity, because I think for many of us, we don't have those opportunities. I'm definitely at home. I work from home. My children, we're a vulnerable household. So my children have not returned to school yet. And so taking on different topics was the goal to kind of help us all cope and talk about and discuss the different angles on the pandemic. And today's speakers, I think the key theme we were aiming for in the September timing was about our children. I think children are at our front of minds for everybody, not only the people who have children, but people who don't, because right now the debate about whether our children should go back or not is at front of mind. I think I was very touched and informed really about different angles on the pandemic. I speak to you as someone who is in a privileged position with a job, with access to technology, with healthy children. And I think the speakers today, whether they were talking about equity-seeking groups whose the divide gets compounded, our homeless and precariously housed youth or the disabled, are talking about an angle that brings greater depth to the challenges that we all face with the pandemic. And so I think that I'm hoping that you found this very informative. I think myself as a mother, I'm struggling. My children are still not actually back. They're in the Toronto School Board. And because of the challenges with online learning, they're still not in class. And so I think one of the things personally, like I think we approach this, and I approach definitely the speakers that I invite as a scientist, trying to bring you all the most high profile speakers and some of the best York professors in front of you. But I think it's a topic that it's hard not to see as a mother and as a member of society, not just a scientist. And so I'm hoping that these conversations, they've definitely given me new perspective as I'm coping myself with all the different challenges to a pandemic. And so I think one of the biggest challenges and one of the things that I face personally, and I think that many of us are facing, is uncertainty. And I think that, in my role as Associate Vice President, researchers are constantly asking me, when will we go back? When will we be normal? Can we get on campus? So many of you would recognize and realize that universities are definitely not at full capacity. We've moved to online teaching, and a small proportion of our researchers are on campus to mitigate risk. And so I think that what I'd like to be able to pose to the speakers today, and I'd ask Dr. Parekh, Dr. Shah, Dr. Gaetz to show their screens, is to ask a question about the future. So recognizing that I myself have been posed many times as an administrator at York about when we'll be able to come back. What do you see is going to happen maybe in the next year, in the next 5 years? With the questions that we ask, we're experimenting with the format. So we're hoping for, if you could respond in around a minute or two about your top thoughts. And then what we'll do is we'll switch over to moderated questions from our audience. So I don't know if someone wants to start. I don't want to put anybody on the spot. I'm so grateful to have you here today. Does anybody want to talk about the future a little bit? And I know it's only best guesses, but in a year, where do you see yourselves? And maybe in 5 years? I think I will pick on Dr. Gaetz because you did talk on those topics a little bit on your talk. So this can give you an opportunity to take a 1 or 2 minute deeper dive on some of the topics about post-pandemic.
Well, I don't think we can do this kind of work without being hopeful, because the current situation, both with the pandemic and with the crisis on homelessness, are destructive to human beings. With the pandemic, it's really hard to predict. That's one constant of, I've done a lot of research on pandemic planning and that kind of thing in the past. And pandemics are, the course of them is incredibly hard to predict because of the particular nature of a given virus or disease. And we can see that with coronavirus. We don't know, there's lots of things we know, but there's lots of things we don't know. We barely understand the transmission. We don't know that if you get if you get COVID-19, are you immune? And if you are immune, is it for a year or is it forever? There's lots of uncertainty. We don't know when a vaccine will be ready. You know, human history shows that pandemics do pass and can have different consequences. But I think my hopeful side is that I think in Canada, there's general consensus about working to mitigate the worst effects of the pandemic. And I think people will need to fasten their seatbelts because I feel it's going to get worse before it gets better. In terms of homelessness, I'm really thinking that there's an opportunity to change things, and that's the work that we want to do and support. It's a big change management exercise because we have this huge investment in a crisis response, and people are used to doing things in particular ways. And it's not a vote-getting issue. I have no illusions that it will ever be a ballot box issue how we respond to homelessness. It takes incredible leadership to change things. And I do feel that the current federal government is leaning in the right direction. So I'm hopeful that prevention will be prioritized. That was more than a minute, but that's the way it goes.
Thank you, Dr. Gaetz. Vidya, Gillian, do you want to go?
Yeah, I can jump in there. Thanks, Steve, and thanks for the great question. I actually want to frame my question a little bit around a question that Dr. Shah posed in her presentation around whose challenges are deemed important to address. And I think that my hope is that from what we have observed in relation to disability and COVID over the past few months, in terms of the equity issues that have come to the surface, that will push the public agenda and the political agenda into a way that does prioritize ensuring more safer measures, community care, client-led care, and can really take a deeper look into the inequities that are created through institutionalized care structures. So in my being hopeful, as Steve put it, I'm really hopeful that that does take place and happen. I mean, history does not make me incredibly optimistic looking back in terms of how long these crises have been in place and in play for. But I am going to take a note from Steve and be hopeful that with what we've seen and with the public attention to these issues, that change will begin.
Thank you. Vidya.
Thank you, and such a great question, Rebecca. Thank you so much for asking it. And I think, like Steve and Gillian, this idea that there's so much uncertainty and that there's, it really feels to me like we're at a bit of a point where we have to decide which way are we going to go as a mass collective. And, there's been I want to really sort of emphasize the importance of activism that's been happening on the ground in so many different ways. We're seeing activism happening through social media. We're seeing activism happening in the streets. We're seeing activism happening, you know, sort of behind the scenes, trying to mobilize change in different ways. And there's a growing sort of energy and a growing willingness to address and to acknowledge and to name some of the very deep-seated crises that have existed for a long time. And so I think this time, I think the shift in how we are operating with one another has really opened up the possibility for us to think about how do we do things differently? You know, the return to normal only works for particular people who have benefited from that normal. But for everybody else that has not benefited from that normal, this is not a time to return to normal. This is a time to demand something different. And so I want to just sort of, you know, huge shout out to all the people that are actively working in many ways through scholarship, through social media, through their relationships, through massive structural change, to ensure that as we think about settling into a new normal, then that new normal takes into account many more people's experiences, many more people's pain and suffering, and that we challenge this notion of what constitutes a crisis.
Yeah, I agree. I think, you know, ending this set of questions, I really do believe we can take some hopeful notes if we don't let us go back to the old normal. And I think that I've seen that the use of technology, if we can get phones and smartphones more widely distributed in other ways, or iPads, things like that, particularly as I'm a scientist and I study infant pain. And so, and I'm a psychologist, a clinical psychologist. And what we're seeing is that we can actually reach out way more than we could when you had to come in and see a psychologist face to face. And so, you know, one of the organizations I volunteer for, the Psychology Foundation of Canada, has always been about getting scientifically proven strategies to help the marginalized into their hands. But we are limited, where the move to online has allowed us to reach more people. And I think as scientists and scholars, the idea of the global south, our workshops and our conferences are now forced to embrace a new model where you don't need $5,000 to travel somewhere to have your research or your science heard or to participate in these conferences. And so as we think about the marginalized and looking at strategies that the people who benefited from the normal forced because we needed to keep going, we can't let those go. I think that there's some pieces of optimism in our switch that can actually engage, enable, and bring some of the marginalized people who haven't been able to benefit. If we can, again, get that technology, I think technology can get into their hands. And I think that there are greater potential, even for people who are just on the edge, who only have that smartphone, for example. They don't have computers and things. So now what I'll do is I'll move now to taking the first question from the audience. So this question is from Zoe M. And the question is as follows. How do we as civilians hold those who have power over the education system? How do we hold them accountable for promises and get better visibility to decisions being made before they're made so that we can influence the decisions? It's really this idea of how do we intervene before it's too late and the decisions are already made? And I'll just leave it to whoever would like to first take it.
Okay, I'll jump in here.
Great. I do not. I will come after you, one of you, three of you. So.
You know, I think it links to what I was saying earlier about the activism that's happening, and what ends up happening in 5 years, I think in many ways won't be by chance. I think that we need to create what's going to happen in 5 years. We need to actively, as people that, you know, care about public education, that care about access for all students, that care about opportunity for all students, that care about outcomes for students that are in which they are proportionate to the percentage of students that we have in our schools and our school boards. As people that care about these things, we have to take this kind of activism into our own hands. And so this means that we are putting pressure on our MPPs. This means that we are taking to Twitter or to whatever it might be as a form of activism to say, these are the questions we have. We are asking for questions to educate ourselves, to call things out, and that we do this as a collective. I think that's really important as well. There's been a lot of groups that have come together around this in various ways. There are groups that are tackling and addressing and naming anti-Black racism. There are groups that are tackling and addressing and naming, anti-Indigenous racism. There are groups that are tackling and naming poverty and the marginalization of poverty in schools. And so we want to think about, how do we do these as collectives, and how do we see the connections between these different advocacy groups that are advocating for particular populations? How do we build connectivity and networking between those collectives so that there's a stronger voice and that there's a stronger push forward? So it's being vigilant about what happens. It's seeing, the policies that are put in place. It's connecting researchers to community activists, to politicians, to parents, and building strong networks so that these are issues that we can educate ourselves on and that we can speak back to collectively.
Thank you, Dr. Shah. Anyone else would like to comment on this?
Sure, I can jump in as well. Yes, absolutely, to what Vidya was speaking about. I think organization is key, and again, those finding those cross-group commonalities in order to bolster that collective action is absolutely necessary. I don't know how many parents are out there whose children are in the Ontario education system today, but maybe like you or like me, you have been writing to your premier and your education minister, and emails have gone unheeded or unresponded to. So I appreciate that there are a lot of parents out there who are attempting to address and speak to those who are in power and may feel discouraged around that front. But I'm going to steal a quote from a colleague of mine, Paul Gorski, and he always speaks to how it's really important that we continue to look up the power continuum in our fight. So therefore, when we think about the pressure that teachers have come under and that schools have come under and school boards are come under, we have to really make sure that when we are looking to strategize in our collective activity, that we continue to look up the power continuum to those who are really making the decisions, because a lot of times boards and teachers and schools take a lot of flack for decisions that are out of their hands when it comes to education policy and practice. So I think that would be my short piece.
Yes, thank you. Dr. Gaetz, did you want to chime in on this question?
Sure. Very interesting responses from my colleagues, and I agree with both of them. I think as a researcher in a university, one of the things I think the institution of the university has to do better work. This isn't about York. I think York is a leader in this area, is around knowledge mobilization, right? Like if we're in the business of producing knowledge through research and scholarship, how can we enhance the likelihood that that research will be taken up and applied? And we don't train new scholars very well on this. There isn't a strong tradition of it. And, but there is a lot of knowledge out there how to do it. So I think it's incumbent upon us who are in that kind of space, who do that kind of work, to do a better job of that. And it builds on exactly what Dr. Shah and Dr. Parekh suggests. Like, I don't think we can have research impact without intensive and meaningful collaboration, right? So everything that we do with the observatory is done in collaboration with non-researchers. That's absolutely key, and it has to involve the co-creation of research agendas, developing agendas that answer questions that are going to help. But it also means community engagement strategies, government relations strategies. So Gillian, your comment is like absolutely true. We have to work up the power ladder. I hear from teachers in my grad course where they've been instructed by either administration or the union to not, if someone's experiencing homelessness, it's not their job to assist, right? Like that's harmful, right? So you've got an institutional response that blocks people from even helping. So we need to do a better job on that, and that should be part of standard learning in research institutions. I'd like to see more of that. And as I said, York is actually pretty good at that, but it's still, there's a long way to go. And we're seeing impact, right? Like, as I said, there is a lot of knowledge about how to do that, but we have to train people and give them experiences on how to do that kind of work more effectively, I would argue.
Gillian, you want to pop in there for one more quick comment?
Yeah, quick comment. I love what Steve said about the focus on research and building research into in collaborations and with community. I also think I would like to implore research communities as well to ensure that the results of the research are accessible and are made in accessible formats and to the public and written in ways that are accessible, because I find a lot of times research ends up getting moved away into inaccessible journals or inaccessible books and does not have the public influence that it could, and especially if it was taken up in these types of discussions and struggles.
Yeah, important advice from across the panel. I think the idea of the synergy of response, so a voice alone is never, is often not heard. And especially when we're dealing with marginalized groups. And so coming together through social media, through different aspects of parent groups and having community groups coordinate is a good way to help, in addressing the question that was originally kind of brought us to this discussion. And I think the idea that it's a responsibility of all researchers, and I think, federally I see as a research administrator type, that that's what the government is calling for more and more, is that research that is relevant and co-created with the people and with stakeholders. And I think that's the language we all have to teach our students, is that you want to do research with the people, for the people that you're working with. So what I'm going to do now is actually try our first live Q&A of our first Europe Circle online virtual here, and so in this new format. So I'm actually going to call on Hanifa Memoji to ask their question live. Hanifa, could you please unmute your microphone and ask your question now?
I think I unmuted. Can you hear me?
We can hear you.
Fabulous, thank you. Okay, my question is, I'd like the notion of prevention to addressing homelessness. What would be the #1 opportunity to focus on, given that the funding is stretched over multiple challenges at this time? I know that's a toughie, but and people usually say you can't really focus on one thing, and it's about change management. But we are, like, the economy is not in a good shape. So if we had to prioritize where the funding would go, where would we send that to? And thank you for letting me speak. Thank you.
Thank you, Hanifa. Would someone want to take that question first?
Sure, I can address that. That's an excellent question, and it's one that gets asked. I think a starting place is to combat the argument that we can't afford to do it. People may not realize this, but there's an economist, Eric Latimer at McGill, who's done all kinds of cost benefit analyses of responses to homelessness. In Toronto, the cost of keeping someone in a state of homelessness for 1 year is $59,000. That's the cost for shelter, for increased healthcare utilization, for involvement with the criminal justice system. For $59,000, we could house somebody and put 2 social workers on their back. And not that I recommend that, but we could do that. So in terms of what we should do, we have a lot of knowledge that we've been producing around early intervention with youth, Youth Reconnect. We just released a program model guide on that, enhancing family natural supports, housing first for youth. But I think the one thing, the real innovation in how to respond to homelessness from a prevention perspective comes from Wales, where in 2014 they introduced homelessness and housing legislation that enshrined this notion of duty to assist. And what it meant in that context was that the local authority, if they became aware that someone was at risk of homelessness or had become homeless, they had a requirement that an offer of help was to be made within 2 weeks, right? And so if the person accepted the offer of help, they had to remedy the problem within 56 days, which they call 2 months. I'm not sure why, but anyway, and what they've seen is they started to drive down the numbers of people who become homeless and avoid that thing that I was talking about when you expose people to homelessness, all the harms that happen. That legislation has since been taken up and replicated and improved in England and then in Scotland. One of the things we're doing here in Canada, because I can't see a provincial government legislating something like that right away, but we want to do some pilot studies, and we were on the road to, well, we're still designing it, but doing one in Hamilton, where we would work through public institutions. Right? So what if we put a duty to assist expectation with any adults whose work involves young people? So teachers, social workers, doctors, nurses, employment support workers, community workers, but not just a requirement, you have to help, but provide those kind of on the ground supports that will enable a teacher or a doctor to get the young person to the help they need. So there would be like an expectation that you help the young person get the help they need. And I think that that's the future. And it's something that can be implemented, and it would be helpful to teachers and to doctors who are faced with, you know, like teachers will know students are experiencing homelessness, but don't know what to do. So if we built that out through using Youth Reconnect as kind of the frontline support to help do that, we could transform our response to homelessness and produce better outcomes for lots of young people, helping them stay in their community, stay connected to school, improve their relationships within their household, and address all the things that put them at risk. We could transform the response to homelessness, and it is affordable. It's just going to take some public will and a challenge that we have in Canada, which is true in most countries. Until we develop the evidence base in Canada, there will be a lot of resistance to it, because people always are like, well, that might work in Wales, but not in Canada. And I always believe any innovation from another country, doesn't matter where, if it's from you know, Peru or Australia or anywhere, the question shouldn't be, can it work here because the policy context is different? The question should be, how do we adapt it to Canada? So I'm very hopeful on that. To the people I work with, like Way Home Canada, that's the future. And so it's actually quite exciting.
Thank you, Stephen, for your thoughts. Gillian or Vidya, do you have thoughts about where we should be prioritizing the economy in a limited restricted financial situation?
My very short answer is that we need to, as Steve is saying, increase supports for social safety nets and for larger structures that can maintain this sort of long-term sustainability for folks. And that means at the same time that we need to ask ourselves about, you know, those that are benefiting from tax evasion and those that are benefiting from all kinds of things where money could be redirected back into the public good. And so these are big questions, and we need courageous leaders that are going to be able to stand up to that and put policies and practices in place that actually create the social safety network that we need. And we're seeing, especially in these times, that we are only as strong as those who are most vulnerable in our communities. If there's anything that COVID has done, is that it's recognized that we are deeply interconnected, and it's hard in many ways to, you know, while there is a color to COVID, while there is a price tag to COVID, there's also, we're also thinking about the fact that we are all deeply interconnected in this way. And so hopefully that is a shift in a different direction for us.
Thank you, Dr. Shah. Gillian?
Great. I just have a short piece. I would like to see funding being prioritized around just enhancing actual choice for folks with disabilities in terms of how they access their care, how they access education, and so forth. Yeah.
Thank you. So I'm going to turn again and read out one of our questions that was put in through our Q&A function. So Mike Sullivan asks, the TTC has eliminated the fare pass. It's for new and renewing patrons, asserting that during COVID, the administration of the plan is more difficult. It's another support for the marginalized and those living with disabilities being removed. There's no plan to resume it. Could the panel comment on this TTC policy? I think there are a number of different angles to comment on, but I think the idea is that we're seeing a very important municipal support being revoked. Gillian, did you have something?
Yes, I apologize, Rebecca, I had some background noise. Can you please repeat the question?
Sure. The question was just posing about the current TTC policy about eliminating the fare, and it's FAIR, fare, F-A-R-E, pass. And so asserting that during COVID, the administration of something like this is too difficult, but another support for marginalized and disabled people by giving them, I think it's discounts or actually free access to the TTC. But I think it was harder during the pandemic to actually be able to do the checks necessary. And so instead they just took it away. And any comments, I think, what can be done, what should be done? Any thoughts on this?
I can just jump in. I'm not familiar with the policy per se, but I think what Dr. Shah had discussed around thinking about Naomi Klein's work on the shock doctrine around what happens and what gets taken away through the excuse of a pandemic, for example, or some kind of emergency. And I think that we see that all over in terms of what gets lost that is intended to be for the social good during a time of crisis. So that's that's what I can contribute.
Any other thoughts?
Well, yeah, a challenge is that things cut multiple ways during a pandemic. And so, cutting programs like that, when there might, if there's a problem with administering it, there's probably other solutions outside of like cutting it. And you worry about that kind of thing happening more and more, and it may happen more and more. We may have a return to austerity, but I think at the same time, hopefully, there are many people who, even though we've been like taught for several decades that government is inefficient and government doesn't work, this kind of thing, I think there are others who maybe see now that, well, there is a role for government, and that, what, sometimes to have a just society, we need to spend money, and that might mean tax increases. Certainly, Dr. Shah, you were talking about the there's a lot of wealth that a lot of people are benefiting right now during the pandemic. But you know what, my taxes should go up personally. I'm a person of privilege, and we just need to rethink what the role of government is and work towards that just society coming from every direction possible.
Thank you. So we're actually coming to the time. I apologize. I see all the questions that I am unable to forward on to the speakers. I want to thank everybody for posing their insightful and engaging questions to our speakers, and my apologies to those that we couldn't get to. I want to also thank our panelists for being here and leading this important discussion. It was really an honor and a privilege to host all of you this morning and to get to hear and listen about your programs of research in depth and the impact that during this very critical time. So I'm going to turn it over now to Julie Lafford for a few final housekeeping items before we say goodbye. And Julie, I just want to say my sincere thanks to all of you and the alumni engagement team for delivering the York Circle sessions in an online format and launching this new at-home series so that we can continue to bring to our audience, to our York community, timely and thought-provoking discussions during this very unprecedented time. Thank you.
Thanks so much, Rebecca. It's a real pleasure, and it's so great to be able to collaborate with you, even though we're doing this virtually. So thanks, Dr. Pillay-Riddell, for leading us today. And to our panelists, Dr. Gaetz, Dr. Parekh, and Dr. Shah, we're really pleased to be able to give a platform for this important conversation I wish we had more time for questions. There's just so much to unpack on this topic, and we're experiencing that a lot in a lot of the lectures that we're presenting. Thanks to everybody in the audience for taking the time to join us and participate in Q&A. I'm going to wrap up really quickly here, but before you go, please take a moment, and we have one last poll for you, and this helps us tailor future York Circle events. Please take a moment to respond to this question. How would you rate your knowledge of the topic on today's presentation following this discussion? So please, as I said, take a moment to reply, and thank you for your participation. It's now time to announce our winners of today's $25 gift cards, courtesy of our partner MBNA. And this is available to those who registered for 3 or more York Circle sessions. Today's winners are Susan Lieberman, Hanifa Mahmoodji, Ishnan Singh, and Donald Walker. Our team will be in touch with each of you after this event to fulfill your prize. Congratulations. And I just want to remind you as well that our mug giveaway is finished, but anyone else who registers and attends 3 or more sessions in the future will still have a chance to win 1 of 4 gift cards at each event. All courtesy of MBNA, of course. And our next session is happening on Saturday, November 1st at 10 a.m. And it's titled COVID-19 Vaccine Production, Policy, and Politics. I hope to see you there. You can register and find out more information about upcoming York Circle at Home events on our website, yorku.ca/alumni and friends, and click on events. The link should appear on your screen there now. Finally, we're always interested in hearing from you. Suggestion, feedback, comments, concerns, please send them our way. The email address is alumni@yorku.ca. You can also give us any feedback through our social media channels on LinkedIn, Facebook, Instagram, or Twitter. You can find us at York University Alumni or at YorkU Alumni. So today's presentation will be posted on our York Alumni YouTube channel, and we encourage you to share it with your friends or anyone you think may be interested in these topics. Thanks again for being here today, for spending your Saturday morning with us, and take care of yourselves and each other.